Thanks for that kind introduction. Go ahead, Kevin. Traditionally, the healthcare-related fields, medicine, psychiatry, psychology, neuroscience, have focused on what's wrong with us and how do we fix it. They're about deficits, disease, and dysfunction, and that's a really good thing. Because of this emphasis on ill-being, we have new ways of identifying people with illness. We have new ways of helping people with mental health and physical health challenges. It's a good thing. However, I don't think the focus on ill-being is the only thing. I think we can also focus on well-being. Positive psychology represents a newly emerging field of psychology. It's not concerned with the question, what's wrong with you and how do we fix it? It's concerned with the question, what's right with you and how do we make it even better? What's right with you is your spirituality. It's your ability to love and be loved by others. It's your gratitude and your kindness, and of course, it's your happiness. It's your satisfaction with life. It's your bravery. Positive psychology is the study of what contributes to our flourishing and to our thriving. In short, positive psychology is the study of what makes life worth living. Currently in science, I think the balance between the study of ill-being and well-being is out of balance, is out of whack. Currently in science, there are 17 articles on depression for every single article on happiness. I don't begrudge the research on depression. I just think it's out of balance, and I'd like us to focus more on what contributes to thriving and flourishing. And the reason for that is there's an intimate, strong link between health and happiness. There's a lot of examples of that in the literature. Let me just focus on 3 happiness-health links. The first link has to do with strokes. Individuals who are happy prior to having a stroke recover better. They recover more behaviorally, sitting up in bed, walking, going back to work, and they recover better cognitively. Happiness buffers us against the adverse effects of strokes. As a second example, has to do with the immune system. When people are experimentally exposed to the viruses that cause colds and flus, if people are made happy first, they're less likely to catch the cold and the flu and report that the symptoms, if they do catch it, are only half as severe. Happiness boosts our immune system. And the final health happiness example I want to talk about has to do with longevity. Happy people live 7.2 years longer than unhappy people. And that holds up even when you take into account smoking, diet, and exercise. Happiness, and they're happy extra years we're getting. So what's my hope here? My hope is that we can implement the findings of positive psychology, implement them to help people and focus on well-being, not just ill-being. But what does that mean? Well, let me give 3 examples of that as well, bringing positive psychology into healthcare. First comes from counseling. In traditional counseling, what we do is somebody comes to the office of the therapist and the therapist says, "So, what brings you to my office today?" That's actually a secret code. It's a code for what about your life is so crummy and miserable that you had to come for counseling today. In positive psychology, you don't focus on what's wrong with a person. You don't focus on weakness. You focus on strengths. And you say, let's talk about your strengths and how we can use those strengths in creative ways to improve your well-being. So, the first session of positive psychology, you're left with a feeling of confidence, optimism, hope, and you come back for other sessions. The traditional way is we feel sad, we feel weaker, and we don't come back for the follow-up sessions. As a second way of implementing positive psychology into healthcare is a high-tech solution. Imagine, if you will, that you could use your smartphone in order to get an accurate assessment of your well-being that was accessible and meaningful based on patterns of your moods, your stress, and your sleep. Well, this has actually been done. I'm working with a group called PERCT, and we've developed an application that does just that. It marries neuroscience and positive psychology together to inform you of your well-being and then to give individual customized interventions to enhance your well-being, your relationships with others, your mindfulness, and your life satisfaction. And the third way is a low-tech way. It's an abandoned house in Louisiana. Candy Chang is an artist, and she took that house and she covered it in blackboards. And on the chalkboards, she stenciled over and over again, "Before I die, I want to," and people filled it up. They didn't have to. The community wrote all over it. And it's done this in dozens of countries it's been used. My favorite is somebody wrote, "Before I die, I want to be someone's cavalry." The cavalry coming to the rescue. And I thought that was beautiful. This person writes, "Before I die, I want to be tried for piracy." Now, we thought we could use these, not just in communities, but we thought we could use them in hospitals and hospices, in schools and university, and we started to do that. We put them in elementary schools and junior high schools, and we say instead of "Before I die," we write, "I feel happy when." One child wrote, "I feel happy when I fart." But what's amazing is the children's well-being improved by being engaged in these. And I think we can change it from "I feel happy" to "I feel grateful, I feel meaning when." So what's the big idea here? The big idea is that we start taking the science of happiness seriously. That we recognize that when somebody's depressed and we get rid of their depression, it doesn't mean they're happy. It just means they're not depressed anymore. That we start focusing on flourishing, we start focusing on thriving. My hope for healthcare is that we start taking the science of happiness seriously. Thanks so much.